You mentioned one of these devices, the Cochlear apparatus, that is used and probably the most known technology in terms of improving the hearing of patients with hearing loss or hearing impairment. Can you maybe introduce it and tell us how does it work actually?
Yeah. So we're talking about the cochlear implant, which you can think of as a prosthesis. So we have a prosthesis for hearing. And, it's our best neuroprosthesis, actually, and it's a really amazing story. I would just first briefly say what it is and what it does, and then we'll give a little bit of a historic and maybe also outlook perspective. The first thing is, think of a microphone like we're using here, picking up sound, and then sort of extracting information from it, which frequency has been used, which amplitude has been used, etc. And then basically this information is computed into a series of electrical stimuli that the little computer that we usually would wear behind our ear ships to a transmission coil that is that you see when you talk to a cochlear implant user, because it connects to the implant, and the implant is sort of embodied in our temporal bone, and it emanates a thread of electrodes that runs straight into the cochlea. And so it is inserted into the cochlea where previously functional hair cells would have been. And it replaces these sensory hair cells by directly stimulating the auditory nerve. So this thing takes advantage of this frequency organization that we briefly touched upon of the cochlea. So we know that the neurons at the very base of the cochlea encode for high frequencies. So information that is being picked up by a microphone, processed by a computer, will be shipped to the electrodes that are sitting at the base of the cochlea, while those signals that contain low frequencies would be shipped to the ones that are sitting at the apex, where the neurons are in charge of encoding low frequency sounds. And despite the fact that we have just between 12 to 24 electrodes, while we can, as a normal listener, distinguish like 2,000 frequencies, this is working. So people can, after a rehabilitation phase of typically 1 year, understand speech, and primarily in a quiet setting like we have here, and that is so amazing. Mm-hmm. And it's really so fantastic that you can counsel a patient that turned deaf and say, well, you're not going to be deaf, you're going to hear, and you will need to undergo a surgery and an extended rehabilitation where you need to work hard in order to make sense of the signal. Brain needs to learn kind of a new language, if you wish, relearn hearing, and then you will be good. And so when this was started in the 70s of last century, it was not an easy run, because everybody was critical that you would never replace this fascinating hearing process that we have in our body. And people were quite skeptical whether this would actually be helpful. But, there were courageous patients, there were courageous doctors and engineers, and they made it happen. And it has improved, to multi-channel stimulation, new coding strategies, and you name it. And nowadays, people go to school, people go to university with that, people work, and I think that is really remarkable.